interesting because you had knee pain for a while that wasn't getting addressed. If you don't mind telling us what you went through, you know, who you went to go see, what you ended up going through, and was it effective, and kind of what led you to find me.
I guess really the hip pain is what started, like within a week after running a 10K. And, you know, I went to a chiropractor, and actually originally the chiropractor helped after a couple months, 2 months maybe.
What did they tell you what was wrong?
It wasn't aligned, like one was higher than the other.
Okay.
Something like that. It wasn't aligned, so they got that back. They released me to run again, and they did tell me to come back once a month, but I was feeling so good. But hip pain started again after maybe a month or so. But at that time, you know, I kept going back to the chiropractor, and it never got better. Actually, everything got worse. So after the hip pain, it, you know, started going down my leg into my knee. So then I was having knee pain, and then also my ankle started going numb. So I knew something was pinched somewhere, but I kept going to the chiropractor thinking they would undo it. And I think the final symptom was like something was off in my sternum. Like I knew I was getting progressively worse, but yeah, the knee pain led me to go see my knee surgeon, because I thought, you know, it's been 11 years, maybe something happened, maybe something, I don't know, you know, in the meniscus or the ACL. So they gave me an MRI and said, you know, a little degenerate, you know, normal, whatever, wear and tear. And I am a runner, but he didn't think anything was wrong. He was going to give me the hyaluronic acid shots. So in the meantime, I still had sciatic pain coming and going. That was, you know, the original pain. So I started looking up on the internet any stretches I could do or any programs I could do. And that's where I found you guys with, you know, it's one thing to just find stretches, which I'm okay with, which none of them really helped. Oh, I also went and saw a neuromuscular massage therapist, which did give me relief. And if I didn't get relief by next week, I was going to go see her again. But it came back. After seeing her, it would always come back. Everything came back. So I was trying to do stretches at home and things at home, and that's when I came across some of your videos about, you know, being able to get better and stay better and do a program and get stronger. And that's what really interested me and led me to do the consultation. And
so when we started, what was your thoughts at the beginning? Because I was treating you for hip and knee pain, and I was primarily focused on your spine.
Yeah, that, it just, by watching a bunch of your videos and actually reading your book, the book is what really got me, because it, you know, if someone just says that, like me trying to explain to people, and, you know, I talk you up all the time and try to explain, well, did you know, ever think it's your spine? Would you consider reading this book? And even when I had my last little flare up and my knee hurt, it still was blowing my mind. I knew my knee pain was coming from my back of my spine because of what I'd been through. But when you're in that pain, like all I wanted to do was rub something on my knee or put ice on it. And I knew it wouldn't help. And that was blowing my mind. Like even after, you know, it's so hard to comprehend. I think reading the book, though, really, really is what hooked me and made me think, you know, I think this guy is onto something here, because I think the regular medical community just follows their protocols. And, you know, no one's like Dr. House anymore, really trying to figure out what's going on.
Well, and like what you said, you know, when you're in it, and I have some examples in the book for me too, right? Where I had calf pain and I was just focused on my calf and I wasn't looking at the big picture, and it wasn't calf pain, it was my sciatic, right? And same thing, when you have knee pain and you go to the doctor, they're really only gonna look at your knee.
Absolutely, absolutely.
Did anybody along the way, did any of the doctors or anything say like, hey, it could be your spine, it could be a nerve issue?
No, I personally knew it was a nerve issue. I knew something was pinched. I know what that feels like. But, you know, I wasn't sure about the knee thing. But that, I love my Rothman surgeon. I think he's very knowledgeable and he has a very good reputation. And never, not once, did anyone ever suggest that, or he just, I even asked him, I told him what's going on in the hips and everything. And like you said, he literally was focused on the knee. If my sciatica came back, he said he knew, a good colleague to send me to. But
And anybody that's listening to this, they're going to say, oh, I wouldn't have missed that because you went to somebody with hip pain, knee pain, and ankle numbness, right? All on the same side of your leg, of your body. Anybody out there is going to say, I wouldn't have missed that. Of course, it's a nerve issue, but it is missed all the time. I can't tell you how many people, almost everybody that I see that has the same story as you. So that's why I'm so happy that you're telling it, because you're not alone. It's so many people out there that have knee pain, for example, and then they have some little stuff other places that they'll mention to their doctor, and their doctor just brushes it off, and they don't realize that it's one and the same. It's all the same problem.
right.
So when we started working, I gave you kind of a silly little stretch to do, or movement to do for the first week. Can you kind of talk me through like what you went through? How long did it take until you saw progress?
I feel like I saw some relief like fairly quickly. I was on vacation, I remember, when we did our first session, and I don't know, even after a week or two, I don't know. I just felt like there was some relief. There was something I knew was going on.
I have it in the notes here. On our second visit, you said about 60 to 70% improved. You were able to run downstairs. You had some pretty significant back soreness at the beginning, but you felt like your knee significantly released. Like the nerve pain was almost completely gone.
Yes, now that you say that, you're right. Because when I was on vacation, I was worried about, they wanted to go play pickleball and ride bikes. And, all I was trying to do was just make sure, I could do everything. So I was surprised with the couple weeks that have gone by with just that exercise, and that knee and the ankle coldness had already gone away.
Well, and now we've done 7 visits over the course of, I think, about 2.5 months, somewhere around there. How difficult was the program to maintain? And maybe another question is, what are some of the surprises that you saw just doing the program?
It's definitely something, when I talk to people, even, people that I know, I think could really be helped by this. I think one of the things is, if you're not going to be really dedicated and do it, I think people are so used to running to the doctor to just get that pill and that be it. I think you do have to do it, religiously, do the morning routine and do whatever you need to do in the evening. But what is hard about it is when, you're away for the weekend, or, over Christmas shopping, I had my kettlebell in the Jeep and the kids were laughing at me because in between one mall or another store, I would just do one little stretch, but it's because I did not want to go back to that pain and that, all that discomfort. So, I didn't care about that, but it's definitely something you have to set your mind to and be.
Yeah, and in order to change it, you need to put some work, and that's the big downside to it. The positive side is once you're there, then you're actually better compared to a pill or an injection that just kind of temporarily masks your symptoms, and it does nothing to treat the underlying cause.
Right, but I was pleasantly surprised. I absolutely was surprised that I wasn't running around the house in bare feet. I wasn't doing anything silly. I was just doing some basic exercises under your care that you told me to do. So it wasn't anything extreme or silly. It just was something so basic that you would have to have the knowledge to tell someone to do. But that was surprising to me that it wasn't anything.
Yeah, I think
outrageous.
I think we're 2.5 months in, and you have pretty much 4 exercises to do. The stretch, the little butt wiggle one, the one with the weight, and then the squats. You have variations, you have progressions of them, but it's 4 exercises.
Right. Right.
Your biggest goal was to get back to running. And we got you back to running a few weeks ago. It's been winter, so it's been hard to do. How did you do getting back to running?
I was really nervous when you gave me my homework of, I think it was like over Christmas, you said do a half mile one day and a mile. And I was very nervous. Again, don't want to be in pain, don't want, but I did it. And I, again, was pleasantly surprised. Like, could I tell I had done something? Yes, but just by a little tightness, maybe a little soreness, that I just continued to do my routine and it actually didn't disrupt it at all. And then again, when I did the mile, was really surprised, like doing the actual mile, I, was just normal and same thing, just a little sore. I could tell I'd, done something, but nothing, it didn't give me significant pain or anything outrageous. So I was pleasantly surprised, very, very much surprised.
Yeah, I've been very happy, to help you get back to what you want to do, and that's the whole point of this, right? It's to get people back to what they want to do and keep them healthy and keep them away from surgeries and injections and pills and stuff like that. So it's been great working with you and seeing that progress. Yeah, another thing that I think happened while we were working together is you've been able to lay on your stomach again.
Yes, I'm a side and stomach sleeper, and that was having to sleep on my back while I was in pain was hard, very hard for me. So I was very happy to be able to sleep on my side and my stomach. My stomach is my favorite place to sleep.
I'm sure there's a lot of people out there that would like to be able to sleep on their stomach again.
Yeah, oh, absolutely.
So last question, Kate, if you have anybody that is out there with leg pain, knee pain, hip pain, they're going through it, what would be your advice to them?
Well, I always try to talk to people. I say, listen, do the 30-minute consultation. I just say, do it. Just do it. He's going to tell you if he can help you or not, and he's going to be honest with you. But, people are just stuck in their ways, and their doctor says this and their doctor says that. But
what's been your reception that you've gotten when somebody's had like knee pain or leg pain? You said, hey, it's your back. Because I know mine, I'm that guy. I do it all the time, and I still get so much resistance. What's been yours? Like, what do people say when you're like, hey, it could be your back?
I try to tell them about my experience, and I actually keep saying I'm going to buy a couple of books. And I said, would you read a book? That's what I say. Would you read a book? Because they're like, oh, well, it's this, it's that. Well, I'm bone on bone. That's what people say. Well, I'm bone on bone. You
right.
can't, okay, listen, do the 30-minute consultation, and just see what happens. See if you can be helped. But again, I'm not sure if everyone I talk to is willing to put in the work, the dedication, and even the time, like to take the couple months. I don't know.
Well, and the cool thing is that we didn't mention this, but you're in a different state than I am. We've only done this over telehealth. We've never met in person.
That and actually, I probably, if you were in California, I might never have done that consultation, because you are in Lansdale, which technically I could get to. So I thought to myself, if I had to go to the office sometimes, once in a while, I could get there. I wouldn't have to get on an airplane. So that's the other thing I feel like is a good for you. Maybe you should say you probably can help people all telehealth. I think some people may get it stuck in their head that, oh, well, if I had to ever go somewhere,
Yeah, and to be honest, 3-4 years ago, when COVID was hitting and getting over, telehealth was becoming more and more common. But if you told me 3, 4, 5 years ago that, physical therapy, doing it over telehealth, I would have kind of laughed and, not thought too much of it. But I've been surprised on how effective that we can be
yes.
through this medium.
And people do laugh at me. They're like, so what, you do your exercises and he just watches you? And I say, when you go to real physical therapy, that's what happens.
Yeah.
You do your exercises, they show you what to do, and you do it. Like, that's what happens in person. So, but you're right. It's definitely a little, I think people would be more willing to do it now after COVID and everything.
It's becoming more common, but you're still, you're fighting a few things. You're saying, A, it's over telehealth. B, he's going to look at your spine to treat your shoulder pain, your knee pain, so it's a few things different than what they're used to hearing, and that's definitely a fight to get there to where people are like receptive to it.
Yes, absolutely. But if more, and I don't think many people read anymore, if people would just read the book, I feel like that would give them the and even like my own mom, she got the book and she read the chapter on plantar fasciitis. And I'm like, you don't understand. Read the book front to back and you'll hear all these stories about all this different pain, weird pain, other things that went away after being treated that they weren't even being treated for. I'm like, so I would really recommend the book and read the book. And that really stuck in my head. Like, I really think this may help me. And it's not a long book. It's not hard to read.
I try to make it short for a reason. Yeah, like what you said, we don't read much anymore, and it's short attention spans.
Yeah, but I think that would be a big one. I would really suggest people take it and read it, and I think it would really open people's eyes to see that there's hope, there's a chance. You don't have to have back surgery, or whatever.
Yeah, well, I'm very glad you did, Kate, and I'm very glad we've had success.
Absolutely.